work with a large team of family physicians and nurses in Vancouver and the downtown east side, as well as in Victoria. And we work within the Portland Hotel Society. So this is a nonprofit that provides low barrier housing and treatment and supervised consumption sites and managed alcohol programs to people who use drugs.
I have a focused practice in emergency medicine. And so I work mainly at the Queen Elizabeth Hospital in Charlottetown.
It's a fantastic practice associated with the Memorial University Family Medicine Residency Program, so it's a teaching practice.
My clinic, I think, would be fairly typical of many rural physicians. Certainly, I think I would best describe it as a cradle-to-grave type practice.
We have lots of overdoses that happen outside the alley and outside our clinic, and so we have a crash kit, and I often will go out and resuscitate someone in the middle of clinic.
I work in a collaborative practice with 6 other physicians, a nurse practitioner and a family practice nurse, and collectively we service a population of about 10,000 residents.
Our secondary stroke prevention clinic, I'm a medical advisor for that, and I do some walk-in clinic work. I do some family medicine locums in Nunavut as well.
And so what we do is we do clinics here to the community of Little Current, and then we have satellite clinics in the Wikwemekong, Ondek First Nation and Whitefish River First Nation as well.
J'ai aussi une portion enseignement parce que nous sommes une unité de médecine familiale, donc nous formons les résidents de médecine familiale pour 2 ans. Donc je participe aux activités d'enseignement et pour les externes et pour les résidents de médecine de famille.
The family medicine clinic was designed to address a specific need within the community. In particular, the need was to manage what they called a target population, and these were people felt that their needs weren't being addressed.
And the final sort of component to this whole thing is then the nursing homes as well. We've got 2 nursing homes, one on Wikwemekong Reserve and one here in Little Current.
When I was quite young, I recall being sick and I was hospitalized, and I remember at that time, my, the important role my own family physician played in that. And
I always knew that I wanted to do family medicine all the way through medical school. Often it was because I thought the family doctors were the nicest and coolest.
I think a lot of it was the opportunity for the breadth of practice. A lot of it was the opportunity to work in a rural area.
As soon as I arrived at this hospital with rural family doctors providing full scope of care in, all different environments, from hospital to clinic to house calls, emergency, surgical assists, and I just felt like I had found my place in the world.
D'être témoin d'événements importants dans la vie de personnes et de couples et de familles. J'ai toujours beaucoup aimé ça.
And in my PGY 5-year of urology, I had a very enlightening experience with my then 4-year-old daughter, who really taught me the importance of family in medicine. And it's because of that recognition of the importance of family, I have chosen family medicine as my specialty in my profession.
The kind of understanding that home environment, the person's experiences themselves and who they are on top of their whatever disease or disability has befallen them, to kind of get that better picture of people.
Childbirth, geriatrics, sports medicine, peds, all of it. And there's no way you can have anything like that in anything other than family medicine. So that's why I did it, and that's why I stuck with it.
I had a patient that had came into the emergency room. He was a young man. He was with his mother, and he told me that he showed me the scar on the side of his head, and he said 20 years ago you drilled a hole in the side of my head and saved my life, and he said, you probably don't remember me, and I said, oh yes, I remember you very, very well. He was riding his bike and got hit by a truck and had a severe head injury. And I recall I was working in a rural community in PI at the time, and with the help of a neurosurgeon, we managed to do a burr hole and a craniotomy. And the fact that he was, able to come back 20 years later and thank me for it was certainly very, very gratifying.
C'est au domicile, je crois, que j'ai vécu mes expériences les plus inoubliables, et je pense à une situation où j'accompagnais un couple à la maison, un couple de gens âgés de 85-87 ans. Et ils étaient, le monsieur était assez en fin de vie, il avait un cancer du sang. Et le désir du couple, c'était qu'il reste à la maison le plus longtemps possible. Mais voilà, on était rendu à parler de transfert à l'hôpital. Je suis allée les voir une journée. On a parlé de la maladie, de la fin de vie, des soins, de l'arrêt des traitements aussi. Le monsieur, qui était un homme de peu de mots, en répondant à une de mes questions, il s'est tourné vers sa femme. Puis il a dit, « Sais-tu ce qui me fait le plus de peine? C'est de te quitter. Je t'aime. » Et ça, on était trois à pleurer à la maison parce que j'étais consciente que j'étais témoin d'un moment fort dans la vie d'un couple, d'un très beau moment. Et puis ça, j'en ai eu beaucoup d'exemples comme ça, comme médecin de famille. Ça m'a toujours beaucoup touchée.
And I saw a guy who had seen a naturopath that day and had been told to take hydrogen peroxide for fungus infection in his esophagus. And he had mixed up. He had tried to save money, and he bought a industrial strength hydrogen peroxide and forgot to dilute it and drank it. And when he came to see me, he was, of course, just concerned. He had minor throat irritation. And not knowing what to do with a situation like this, I phoned poison control, and they said, if he's fine now, just send him home. But I kept thinking about how his airway could close off, and he could get kind of a later inflammation. So I pursued a discussion with him, which he was very reluctant to follow my advice. But I said, this is one night of your life. Just go hang out near the emergency. And he said, well, I'll just call if I feel unwell. And I said, by the time anyone could get to you, it might be too late.
So I was the first physician to do this outside the context of research in North America. And the research study, I was so lucky, happened right down the street from my clinic. And when it was published, the researchers came to me and asked if I wanted to start prescribing injectable opioids to my patients. And at first I was a little bit skeptical, but I think as a family doctor, it's the patients that make you change your practice. As I was working in my clinic, I saw a patient and I thought, oh, you need this. You might die if you don't get this intervention.
He was intubated and put in ICU for days. Afterwards, it was probably a month later. He went in and asked what schedule I was on so that he could just come in and thank me in person, which I thought was very sweet.
We were working up a gentleman for bypass surgery for his heart. And in doing so, he ended up having a spot on his lungs. Bumped into them a few times, so I'm in the hospital and got connected a little bit. His daughter and my wife became friends. They had kids the same age. And then, suffice it to say, within the next year or so, he passed away, and I went to his funeral. And I was sitting in the back of one of our big Ukrainian churches here in town, not trying to be at all visible, just snuck into the back. And on the way out, the wife of the gentleman that died was walking out in the funeral procession, and she spotted me and just came over and gave me a big hug. And instantly I had, I was a mess. I was breaking down. I'm sure they were too. And it just really hit home about the relationship and the impact that we can have in our patients' lives, but the impact that they have on our lives too.
So the first year I was in practice, I actually was pregnant with our first child, and ended up having this patient who was due the same day as me. So, you know, we had lots to sort of chat about and be in common. It was both of our first children and, you know, due the same day. Well, then we both actually ended up with hypertension and pregnancy, and we both ended up being admitted. They had decided that they needed to deliver her that night, and she said to the nurse, well, I want to talk to my doctor first. And she said, well, your doctor's not here. And she said, yes, she's in the next room. I need to go talk to her.
I would say, you know, every day I'm amazed that I have the privilege of sharing in the lives of my patients and hopefully make a small contribution and play a small role in the improvement of their health.
This particular eagle feather is one that was given to me by an elderly couple that I've been looked after for many, many years. They've had a lot of health issues, and we've managed to get them through all of it. And I just had a routine set-up clinic one day on the Wikwemkong Reserve with these two people at middle of my day as patients. And they came in and presented me with the eagle feather, which was a deep indication of respect on their part. It was something that very much honors the contribution and the dedication that you have.
I think it's such an honor to be a family physician, and I appreciate all of my colleagues and, you know, all of the people who have created family medicine for what it is today, because that's what allowed me to have my practice.
C'est une grande reconnaissance pour moi, venant à la fois de mon équipe comme du collège. C'est vraiment un honneur. Je le reçois comme un grand honneur.
I think someone out there is saying, you know what, you guys are doing a good job, and we appreciate it.
It's more than going to work. I mean, it's what I do. It's a big part of who I am, and I don't miss not going to work any day.